Okay, we are broadcasting now. Welcome everyone as people dial in here. There we go. We're gonna hear some brief opening remarks from our publisher.
Good evening.
Richner.
My name is Stuart Richner, CEO of Richner Communications and publisher of Herald Community Newspapers. We are really excited for tonight's Herald Inside LI episode to discuss the COVID vaccines and what the near-term future of Long Island may look like in light of these medical achievements. To share their expertise and thoughts, we are honored to be joined by Nassau County Executive Laura Curran, Jennifer Cona of Cona Elder Law, Nassau County Commissioner of Health, Dr. Larry Eisenstein, and Dr. Aaron Glatt, Chair of the Department of Medicine at Mount Sinai, South Nassau. I want to thank all of our distinguished panel for joining us this evening and for your tireless efforts this past year to educate, guide, and keep our communities as safe and healthy as possible during such challenging times. County Executive Curran and Dr. Glatt were with us here on Herald Inside LI almost 1 year ago to discuss the early stages of the pandemic. In some ways, it feels just like a few months ago, but wow, has the world changed in that period of time. Also, thank you to our sponsors, Cona Elder Law and Mount Sinai, South Nassau, for supporting this episode of Herald Inside LI. We have a lot to get to, so I won't delay another minute. I'll now turn it over to Skye Ostreicher, our Herald Inside LI host, to lead this evening's discussion. Skye, over to you.
Thank you, Stuart, and welcome everyone. Thanks for joining Herald Inside LI. I'm your host, Skye. It's been a whole year of the pandemic, a year. We're going into year 2, actually, and it's been a confusing time for everyone. The pandemic really showed us the power held by our healthcare workers and our government officials. And our county's top doctor and top legislator are here with us right now, Nassau County Executive Laura Curran and Health Commissioner Dr. Larry Eisenstein. We also have, as Stuart mentioned, Elder Law Attorney Jennifer Cona from the Cona Elder Law. And we're going to talk about seniors on this panel. We got about 60 questions from the audience already, and a lot of them had to do with seniors. And Dr. Aaron Glatt, who's been on 2 of our panels before from Mount Sinai, South Nassau, and he's the hospital epidemiologist. So let me take a quick selfie of us, and then I'm going to hand it over to County Executive Laura Curran to really set the scene on what's been going on. So smile, everyone. There we go. And audience, as always, you can use that Q&A function at the bottom of the screen to ask any questions throughout tonight's panel. But let me hand it over to County Executive Curran.
All right, I'll take myself off mute, and I want to thank you very much, Herald, Stu Richner, Skye, and the whole Herald team for hosting this and for inviting us to be a part of it. You're going to hear from Dr. Larry Eisenstein, who is our wonderful Commissioner of Health, just happens to be an epidemiologist. Who knew that would come in so handy? And Dr. Glatt, who's been a really important liaison for us as we connect to community throughout this entire pandemic. So as you can see, I'm wearing my Islanders jersey, and it's a real symbol of how far we've come in the past year. I'm gonna go in, I'm gonna greet the fans. It's only the second game since the pandemic hit where there's actual fans in the stands. It's 10% capacity, but I know as more people get vaccinated, as we get back to normal, that number will continue to go up. We're hearing about schools starting to open more. Our restaurants are going to 75% capacity tomorrow. I'm feeling optimistic. We've had about 28% of all of our residents have had at least 1 shot of the vaccine here in Nassau County. I'm really proud of Dr. Larry and our entire team, all of our healthcare partners like Mount Sinai, like Northwell, like the Catholic hospitals, NUMIC, you name it, NYU Langone, have been wonderful partners. And I think that's why we've had such a high percentage. I think the state average is about 22%. We're way above that. And what we're going to continue to grapple with is to talk to people where they are, people who are hesitant about the vaccine, having trusted messengers. I plan to get vaccinated sometime next week. I want to do it publicly to show everyone that I am confident in the safety and the efficacy. of the vaccine. And it really is our passport back to normal. We've been through a lot this year. There's been a lot of chaos, a lot of topsy-turviness, but I really have to commend our healthcare professionals, our families, our workers at the county, at the Department of Health and in public service and Department of Public Works and Office of Emergency Management at the morgue, everyone. The county functions really, I think, rose to the fore and proved to our entire region what it is that we can do. We can do very good work when we work together. So I know that the media plays a very important role in informing people, getting the facts out. And I'm pushing the state to allow journalists and media and cameramen and photographers, et cetera, to be eligible for the vaccine. They have been out there every single day. They have people coming up to them. They're going into hospitals and people's homes. And, I truly believe, and I'm not just saying this because I'm a former reporter, I truly believe that folks in the media should be eligible for the vaccine. So we're not out of the woods yet. Our positivity rate is still in the 4s. So, people are still getting sick. Unfortunately, people are still dying. But I think we've proven, our residents here in Nassau County have proven that if you use common sense and you take care of your vulnerable, we can really get through this. So thank you for letting me say hello, and I'll turn it back over to you, Sky.
Yes, thank you, County Executive. And I know you mentioned you're going to this Islanders game. I'm wondering if you could tell us about the Coliseum becoming a vaccination site.
Well, that's a great question. Yes, so we're starting, the County Department of Health is currently running 3 vaccination sites, one at Yes We Can Community Center, one at the Community College, one at LIU Post, and starting Tuesday morning, we're going to be doing vaccination here at the Coliseum. So, how many we can do, of course, depends on how many doses we get from the state. We're hoping to get more as the production continues and increases. We also know that the state is opening up 3 more mass vaccination sites here on Long Island. So there are more options, more pharmacies coming online, and we want to just give everyone a shot at getting a shot. And speaking of which, we've just opened a line starting today, actually, for seniors, because normally you make an appointment via the computer online. It's not so easy for our seniors. So we've opened up a phone line, a hotline where they can call directly. Their family members can call to help them to help them get an appointment. So I'm looking forward to increasing capacity and getting more people taken care of. Anyone who wants a shot to get one.
Okay, that's awesome. Now, these other mass vaccination centers, they'll be in Nassau County. Have they been announced, those locations? Can people make appointments yet?
Yes. So one is at SUNY Old Westbury, and the other 2 are in Suffolk County. I believe it's in Brentwood and Southampton. And then that's along with the Stony Brook and the Jones Beach sites that the state has already been running.
Okay. Now, I have more questions. We can keep going like this. I know that your time is short with us, but maybe we'll talk a little bit more about seniors and maybe opening senior centers and what's happening in addition to that hotline that you have. How else can seniors have access?
Yeah, this is such an important issue. We know that the elderly seniors are the most vulnerable population to bad outcomes with COVID-19. So doing this hotline is really important. We're also working with our outreach offices, our Office of Minority Affairs, Office of Asian American Affairs, and Office of Hispanic Affairs, also with our Office for the Aging and Department of Social Services, and of course the Health Department, to do outreach as well, as much as we can, to let people know, that vaccine is available, where they can get it, and to make sure that we take care of them.
Do you have any other questions from the panel while we have our county executive here? Before we dive into more of this.
And I'm sure you're going to get a lot of questions about the vaccine itself. There's some myths out there, some misinformation, and I'm sorry, I interrupted the attorney. Go ahead.
Oh, well, I know your time is short, but maybe you could speak for a minute about homebound seniors.
Oh, that's a great question. We're doing a big call tomorrow with our healthcare partners, hospitals, et cetera, on how they're handling their homebound population. And we're hoping to learn from them and have them help us reach more people with our doses that we get. So I'm hoping to have more to announce on that soon. That is something that comes up every single day.
Mm-hmm. And I hope, I'm hopeful also that you'll include caregivers in that, because it's also important that homebound seniors and their caregivers who are largely homebound because they're caring for those seniors, that they can also avail themselves of a vaccination at the same time.
Yes. Yes, absolutely.
Okay, good. Thank
Will
you.
there, another question, I mean, we got a ton of questions and we're going to dive into more of the medical questions with our doctors here, but one of the questions, County Executive, was about zip code specific vaccination sites, if that's something that the county will be looking to have.
Well, we did do a community day in Elmont. That was a couple of weeks ago for people who live and or work in Elmont. We're doing a New Hyde Park this weekend. We did Hempstead. We did a wonderful drive, and it was this one. They're not all zip code specific, but we did one in Westbury at St. Bridget's School this past weekend. So while we don't have enough supply at the moment to go to every community that we want to, we're going to do as many as we possibly can with the supply, and also, of course, with the staff that we have. You know, all of the hospital staff, our volunteers. We have a big army of Medical Reserve Corps volunteers. They're busy. They're working very, very hard. So we need people to do the work as well. We just want to make sure that we're doing it safely and we're doing it efficiently.
Thank you. Anything else that we should address with our top government official here? You've been doing a really great job and keeping Nassau County safe. I know it's the safest place. I know we have, I think, the most vaccinated people than any other big county in the state.
Yeah, that's right. That's right. And it was very important for me to get our government workers eligible, you know, our DPW guys who plow the roads and fill the potholes. And I'm happy that they were made eligible as of on Wednesday. Also, our social service workers, people who work in nonprofits, who are very forward facing, talking to people. You know, I know there's a lot of reassurance when they're able to get vaccinated as well. You know, but, you know, you can have a lot of new groups being eligible, but we also need the supply. And our supply has been a little steady for the past couple of weeks from the state. We get the supply from the state, but I'm very proud of the fact that Dr. Larry and his team has not wasted one single dose. Every dose has gotten into an arm. So we're doing the best we can. And we know that our wonderful healthcare infrastructure, like Mount Sinai, Dr. Glatt and his team are doing the same thing. It's good work. It's hard work, but it's really important. And it's going to get our society open again, which is the most important thing.
And I have to add, if I may, yesterday we hit a milestone. Our health department pods, just what's done by our health department with our few staff and our volunteers, hit 50,000 injections yesterday. So, you know, that's all day, every day working at it. So we're very proud and appreciative of all the hard work everybody's doing. And of course, we have an incredible healthcare infrastructure. So our hospitals, with them, we've done, you know, tomorrow we're going to hit 400,000 residents with at least the first dose. So that's amazing. But the health department's so proud to be a big, significant part of that. Sorry for cutting in there. I had to cheer for the home team.
Of course.
Breaking news now.
Mhm.
Okay, beautiful. Wonderful. Thank you. I know I can keep going through. I have a lot of questions. Another question for the county executive about if people are interested in a specific name brand vaccine, like can they get the Johnson & Johnson vaccine at this location or the Moderna one at this location? Is that something possible?
Well, my advice, and Dr. Larry and Dr. Glatt can speak to this better than I. My advice, and what I will do myself, I'll get whatever vaccine I can get, because whether it's the Johnson & Johnson, the Moderna, which we've been giving out along with the Johnson & Johnson, or the Pfizer, the outcomes in terms of hospitalization and death are the same, and they're all very, very good, very positive. That's the most important factor, in my opinion. So I'm personally not interested in brand shopping. I know that that's a big topic of discussion, but to talk about the nitty gritty of it, I can tell you how I feel, but to talk about the nitty gritty of it, I think I should turn that over to the doctors.
They're both, all the vaccines that are available are wonderful, as the county executive said. I would have zero hesitation about offering to my closest friends, family, co-workers, whichever vaccine they're eligible for, able to get, is the vaccine you should take. These are phenomenal vaccines. They are life-saving. People who take these vaccines do not die of COVID. There is not one reported death. The 100 million plus vaccinated people who has died of COVID after they've been vaccinated and had the appropriate period of time afterwards. When you think about the terrible death toll here on Long Island, in the United States, and across the world with millions of people dying, if we have a vaccine that will prevent death, that's a phenomenally highly effective vaccine, and people should jump to take it.
Another question about the eligibility. So there's different categories of people that are eligible. Who determines that? And when will we know about other categories of eligibility?
So that's all the state. The state determines eligibility and the timing as well. So we follow those guidelines from the state. But, you know, we do advocate. For instance, I'm pushing for reporters and media people. I push for our workers as well. And, you know, the state, we have been getting some good results. And I'm sorry to do this. I have to jump. So I'm going to turn it back over to you. And I just want to thank you very much for having me. Thank you, Stuart. And I hope to see you all in person soon.
Thank you very much.
Thank you. Bye-bye.
Okay, guys. Now it's us. So normally I like to keep these very conversational. It was nice to hear from the county executive, and now let's open it up. I love Dr. Glatt, Dr. Eisenstein, Jennifer, Cona to talk about what you're seeing, hearing, what your concerns are. We'll have sort of a conversation. Again, there's 60 different questions that were submitted, so we can run through them. I try looping them or making them into chunks on my screen, so things are in different categories here. But Dr. Eisenstein, do you want to give us like an overview from your perspective, from the health perspective, and we can go from there?
Sure, Sky. Thank you. So, you know, this has been a battle since Super Bowl Sunday of last year, February 2nd. That was the first day that we had a traveler reported coming in from China that we had to do a quarantine. I'll never forget that day, February 2nd of last year, because since then it's been around the clock for us. In the beginning, it was all about quarantining returning travelers. And then, of course, we had cases, and it was about disease investigation and contact tracing. And then we had to shut down, and so many health department staff have been reassigned to emergency responsibilities. And it's really amazing. If you go to one of our vaccination events and you see all the health department staff there, we have engineers delivering vaccine, and we have, you know, inspectors controlling the line. And we have everybody's just stepped in to help, and it's really amazing. We've been up and down. I'm happy to say that hospitalizations have improved dramatically over the last 6 or 8 weeks. We are still concerned. There's still a lot of new cases coming in. But the fact that, I mean, we've averaged between 500 and 700 cases a day for the last 2 or 3 weeks. It is kind of plateaued. We were hoping to see it continue to go down. But while that number has leveled off, hospitalizations and people in intensive care units have dropped, and I'm sure Dr. Glatt can tell us about what's happening in his facility. But the fact that the hospitalizations are dropping off is really important. I don't know exactly if we just have a transmissible variant that's making people sick but not dramatically ill, if it's a younger, healthier crowd that's testing positive now so they don't end up hospitalized. My epidemiology team is looking into trying to explain it. But I think the lesson is we have reason to be optimistic. Tomorrow, we're going to have 400,000 Nassau residents will have at least one dose of vaccine. There's only 1 million adults. And although there's 1.35 million residents, about a quarter of that is kids. They're not eligible. So the fact is we're going to have 40% of the adults have at least their first shot tomorrow. And that's really remarkable when you consider, it feels like forever, but in terms of an infectious disease arriving, learning about it, creating a vaccine, getting 40% of the population at least one dose, it's miraculous. This has been, I'm starting to hear a lot of people describe it this way. It's been the shortest long haul that we've been through. It feels very long and very short at the same time. It's been so devastating, but I think there is reason to be optimistic. I know there are treatments that a lot of the hospitals are able to give now to help people prevent them from becoming seriously ill. And, you know, Dr. Glatt would be able to speak more to that. But the fact that hospitalizations are going down, even in light of cases staying at a plateau, there's a warning in that. There's still disease spreading. People still need to be careful. They still need to be cautious. But at the same time, and I wrote an op-ed in the Herald that came out a few weeks ago, which I very much appreciate you guys publishing, about the fact that when people are fully vaccinated, and as County Executive and Dr. Glatt said before, we know the chances of them dying of COVID are virtually zero. In medicine, we never like to say 100%, but some of the studies were 100% in this case. Mm-hmm. And I think we need to understand that vaccination is a means of lowering your risk of dying to the point where it does make sense that the activities you participate in are different. I do think we have to have an allowance for people who are vaccinated to not have to live in the same bubble that they've lived in. Now, I'll always wear a mask when I travel in an airplane going forward because we know how well it works. And if you're in an airplane going somewhere fun, you don't want any respiratory virus. It's not only about COVID, it's about disease prevention in general. I've always, as long as I've been around as an infectious disease trained doctor, I'm a bit of a germaphobe, always have the bottles, I guess you can't see it, the bottles of gel with me. I was famous for that. I still do it. I'll always do that. I'll always be careful around crowds, but being fully vaccinated, there is a sense of liberation. There is a sense of safety when you look at the statistics and know if you're fully vaccinated right now, there's really almost no chance of dying of COVID. It's liberating. And for people that are on the fence or unsure about it, look around. People are doing so well with this vaccine. You're not hearing the horror stories. The people who are against vaccine are trying to trump up the horror stories, and it's just not happening. It's not there. The fact is, we're doing so well worldwide with these vaccines, and the results are so amazing. There's a reason to be positive, and I've done a lot of press conferences with the county executive, and I've been saying for the last few months, I'm looking at the numbers and the speed at which I think we're going to be able to vaccinate our residents. And this has been a lesson in supply and demand. We knew that was going to be the case. We knew the first day the vaccine came out, there was going to be millions and millions of people who wanted it and a few thousand doses available. It was frustrating, but not surprising to us. We knew that there wasn't enough Pfizer and Moderna, and Johnson & Johnson didn't even exist for the first couple of months that we were vaccinating. It wasn't approved. But now we're getting to a point where I really think at the rate we're going, about 10,000 Nassau residents a day are getting their first shot from all the combined resources. By Memorial Day, every adult in Nassau County should be able to be vaccinated. And so that tells me we love our summers. We love our ocean on Long Island. We love our outdoor events. If we can truly get all the adults, or at least all the adults who want to be vaccinated, we can have a relatively normal summer. I genuinely believe that. Now, the kids aren't going to be vaccinated yet, probably. So it's not going to be 100% normal, but I do think it's going to be somewhat normal. And even today, you heard there'll be crowds at baseball games. Even if it's not a full house, there's going to be a significant number of people able to go watch our baseball teams. And as a Mets fan and ticket holder, I'm thrilled about that, And I think there's going to be barbecues, and I think there's going to be people going to the beach and out on their boats, and there's really reason to be optimistic. But it really is about people choosing, even if you're vaccinated or not, just be smart. Just be smart about what you do. If everybody were to be smart and avoid the high-risk situations, we really can put this down in time for a normal summer. That's my opinion on it. And even though I do think people who are vaccinated shouldn't have necessarily the same restrictions as those who are not, they still have to be smart. There's still a possibility of spread of disease, although I think it's probably relatively unlikely. It's unlikely that they catch it in the first place. And more the studies are showing that people who are vaccinated are less likely to be asymptomatic transmitters. I know I've believed that's what we would find, but it is true that it wasn't proven yet. And studies are just starting to come out about that. And there was a big landmark study out of Israel, and Dr. Glatt knows all of the studies really well. So I'll leave those discussions up to him. But there really is reason to be optimistic. At the same time, let's be smart. The 500, 600, 700 cases a day, we're doing the tracing. So many of them tie back to social events, parties, and events, the things that we're saying, please don't do yet. Very often, that's where we're finding the disease is coming from. So if we're smart and we take minor precautions and we deal with wearing a mask, which quite frankly has become like a normal part of my day. I don't even think about it until I leave home without it. That's like when you leave home without your cell phone, you have this sudden panic, If we're smart and people get vaccinated and we all continue to try and vaccinate all of us in healthcare, vaccinate the public as quickly as we can, as quickly as we have vaccine. I'm pulling for a relatively normal summer, and I stand by that. And let's just hope nothing happens to derail that.
Now, question, Dr. Glatt, did you want to?
I was going to add on, I agree everything that Dr. Eisenstein said, and I would just stress to people that you can't, at this point in time, think that you're Superman if you have a vaccine, but you do get a lot of benefits. You may not have full superpowers, but you certainly are much better off than if you're not vaccinated. For all the reasons that Dr. Eisenstein said, and in terms of your diminished risk of getting sick yourself. But think about it. It also means that all the people around you are at diminished risk of getting sick. If you have older parents, relatives or friends, neighbors that are at great risk of getting COVID, you're not going to be the one that's going to get those people sick, most likely. If you're vaccinated, you are a friend to every single person in Nassau County. You are doing your civic duty, if you wish, to beat this pandemic. And the best benefit, and as a grandparent, I can tell you that's certainly the best benefit of COVID, you get to hug your grandchildren again. I went through a long period of time where I didn't have that pleasure. And I know that probably the most common question that I've gotten during COVID is how to interact with family and friends, and especially younger grandchildren. That's, I would say, probably the most common question that I've gotten. And now I can say with, I think, a very reasonable sense of medical security that if you're vaccinated and your grandchildren aren't sick, hug them away. Have a good family get together. You can go together with the holidays. I've been telling people that they can celebrate the holidays with their family if the people at the highest risk, the grandparents, any people that fall into the higher risk categories, even if they're going to be with a number of people, maybe younger children, especially teenagers that aren't vaccinated, as long as they're healthy without symptoms right then and there. I wouldn't push my luck. I wouldn't want to say, well, I'm vaccinated, therefore I can go around people that have symptoms, and probably nothing will happen. And probably nothing will happen. But I think in that type of a setting, a little caution is appropriate. But the advantage of getting vaccinated is that your personal life gets back to normal much faster than anything else. And being with family around the holidays is very important to people. And being around family at other times is very important to people. And for couples that maybe don't have family around, but they enjoyed in a senior living center, in a gated community, getting together with friends for dinner or for just a cup of coffee. Now you can do that when both especially are vaccinated. If both of the couples are vaccinated, that's an extremely low risk event. So we go from 6 months ago with, that's dangerous. Don't do that. The mortality rates in older people are unfortunately much higher than in younger people. Now, that doesn't mean if you're young, you're going to have no problems. We're seeing, unfortunately, long COVID, the COVID haulers, the people who have COVID relatively mild even, and they get significant illness and side effects and feelings of fatigue and I just don't feel right, brain fog. That can occur in even younger, healthier people. So it's not just death that is the only statistic that we keep watch on. A very significant percentage of people still have symptoms of COVID 3-4 months after their illness is essentially resolved from the acute illness. And that's another great reason to take the vaccine. And there are even reports people who've had COVID and have some of these long haul COVID symptoms that they've actually felt that there's some subjective improvement in those symptoms after vaccination. Now, we don't know that. The studies haven't shown that yet. But there certainly is anecdotal evidence to suggest that that's an appropriate additional reason to consider vaccination, especially if you had COVID, last year, April, May. So it's not clear that you're really protected from getting COVID again. Certainly there's thought to be protection from getting COVID again in the first probably 6 months after you've had COVID. And certainly 90 days is a magical number that we use that you don't even need to quarantine. You just need to self-assess. But everybody should consider getting vaccinated, even if they've had COVID, when they fall into the eligibility criteria. And that's good for yourself, for your personal family, but that's also good for Nassau County. That's good for the country, because the more people are vaccinated, the more freedoms everybody will be able to take.
So I want to talk about how you mentioned seniors, and that's the number one question you get from grandparents. Can you hug your grandchildren? And I know the county executive mentioned that Nassau County now has a brand new vaccine hotline. I want to bring Jennifer Cona into the conversation. She's with Cona Elder Law, and she also has a vaccine hotline. So I'd love for you to tell us about that and how she's helping seniors get the vaccine also.
Sure. Well, our number one thing that we were hearing in the office day after day was we can't get through to make a vaccination appointment. And we just kept hearing this again and again. And, you know, we have a lot of seniors who are not that technologically savvy, or they just get so frustrated spending 3 hours on the computer and, you know, just that whole kind of thing, hitting refresh. And, you know, it was just so frustrating for people. So we started this hotline. We started on March 1st. And so far as of yesterday, we had signed up, we got people, 135 seniors, we got their vaccination appointments for them. And for us, it's relatively easy because we're used to, you know, the technology, and we're used to sort of dealing with the red tape, and we don't lose as much patience. So we're planning on continuing that indefinitely just to help people because it's, like I said, easy for us to do. So that's obviously been really well received. So I think, you know, to everyone's point here, it takes a village. We all just need to do what we can to get as many shots in arms, as they say. It benefits all of us as a community to continue this effort, and we all need to do our part. So that's what we've been doing, and we're going to keep on doing it until this is all done. But you know, I agree with you that we've got the light at the end of the tunnel, you know, and we're seeing it. It's a little ways away, but we're seeing it, and we're breathing a little bit of a sigh of relief. We're not quite there yet. But you know, different from you two as you know, in the medical profession, from the legal perspective, we've had a lot of lessons in this past year, which have really kind of brought home what we've been preaching all these years about planning. You know, make sure you're getting your affairs in order, always doing the planning, because we don't know what's going to happen when. And that really came home to roost in this past year, for sure. You know, like one example comes to mind where we had a client who didn't have a power of attorney. He ended up with COVID. It was in the hospital for 4 months. He was widowed, children lived on the West Coast. He had no one to pay his bills in the community. His mortgage didn't get paid, his utilities, you know, all the just general day-to-day things that you don't really think about until all of a sudden there's no one there to do it. And he's stuck in the hospital, and no one can, of course, get in to visit him. There's no in or out happening, and the children can't do anything from so far away across the country. That's just kind of a classic example of why it's so important to have your advanced directives in place. Healthcare proxy, power of attorney, and living will. We just don't know what's going to happen. We had another client who did have her affairs in order. She took care of her will and advanced directives, but she was kind of on the fence to do asset protection planning, which is, you know, protecting assets for the future by putting some assets in asset protection trust. Little hemming and hawing, not sure if I want to do it. And we always say, well, you know, if you find your crystal ball, let us know, because we'd love to borrow that. We don't know what's going to happen for anybody at any age, and especially when it comes to healthcare. Again, this past year really underscored that. We just don't know what's going to happen. She ended up with COVID. And unfortunately, as an older person, it was not a good situation. And now she's in a nursing home. So, and she's going to be there for the long haul. So unfortunately, she is going to lose half of her assets because she didn't do the advanced planning that we as elder law attorneys have been preaching to people about. And in our case, in our firm, for the last 25 years, do that advanced planning, protect your assets. Now she has to spend down half of her assets. So, I mean, these situations, or what people really are starting to understand, are real situations. They can happen to any of us at any time, and we really now have to deal with it and not say it's somebody else, it's at some other time, it's not me, I'm too busy, you know, I'll get to it later or whatever. These are real situations that are going to happen to all of us at some point, and we really have to focus on it and get it done, because you can get it done and then not think about it for a while. And so that's what we're really encouraging people. Obviously, getting your vaccination is number one important, But then let's just kind of focus on what we've learned in this past year and take it to the next level of really taking care of ourselves and our families, because that's what we need to do. Same as what Dr. Glatt was just saying. We're taking care of not just ourselves, we're taking care of our family members, our loved ones, our community members, right? That's what planning is about too. You're taking care of not just yourself, but your family members and your loved ones. That's what we're doing with planning and in the field of elder law. So it's really all tied in. And I just can't emphasize it enough, because you don't want to go through a crisis like we've gone through and not learn the lessons. That's why we study history, learn the lessons.
Mm-hmm. Yep. And that brings me to our next question, really, for these doctors in terms of infectious disease and epidemiology. Someone asked if this something like this could happen again with another coronavirus or another airborne pandemic. Could this happen again? Could this be something that happens every year?
So unfortunately, I've been around long enough. I didn't get these white hairs for nothing. This is not the first time we've had such an incidence. I was an infectious disease fellow before there was an entity called HIV. I've been through numerous such, thank God, never as bad as this COVID-19, but we've been through numerous scares and real serious concerns with H1N1, with Ebola, with Zika, with HIV, with tuberculosis. We have all sorts of public health threats at all times. And I hope that this will give renewed vigilance to making sure that the infrastructure is in place. I think part of why COVID-19 took us so hard was because, I wouldn't say we were complacent, because I think the public health officials, the government, the infectious disease societies have always been extremely vigilant. But I think that the likelihood of anybody expecting this pandemic to come outside the professional field was low. And companies weren't geared up to do the things that were necessary in terms of making PPE. We were relying upon China for a significant amount of our PPE, and we know what unfortunately happened there. They weren't able to supply it. There are other types of things that are necessary for us to even make syringes, for us to make the essentials that we would need in order to be able to fight a pandemic. So I'm hopeful that we'll have better stockpiles. I'm hopeful that we'll have a tremendous education from this to know what we need to do, better screening methodologies. I think there were some wonderful things that we learned from COVID that we could put to use in any other epidemic or infection that comes up, or even in non-infectious situations in other public health emergencies. And Dr. Eisenstein is extremely well equipped to address that. So maybe I'll turn it over to him at this point.
Thank you, Dr. Glatt. Yeah, I get asked a lot, am I surprised by this? No infectious disease trained doctor is shocked that there's a pandemic. History is riddled with infectious outbreaks that do a lot of damage. And I have a whole library of books talking about all the various pandemics historically. So we're not surprised that this happened. We've been very worried about the emergence of other coronaviruses, SARS, for example, and watched it closely. And thankfully, those never took off worldwide. So this is not terribly shocking. I think none of us are prepared, even in our own individual lives, for the individual impacts that this had, you know, shutting down entire society. And I know for me, being the commissioner of health, every day through this, I got up and went to the office. And I know I'm very lucky to wake up and have a place to go every day. This has been very, very difficult for so many people who had to stay home. But it's been an incredible amount of work, but we're not surprised by it. But what it does is it does shine a light. And Dr. Glatt said the key thing that I was going to say. The public health infrastructure now is something that should never be forgotten. It's not something, public health, when there's good times, people they kind of don't realize it's there because there isn't an immediate need. And you know what I always teach is, with great respect for the other first responders, and anywhere you go in the United States, if you see a police officer, you know, the color of the shirt may be slightly different, but everybody knows what they do, the service they provide, how they can help. And the same is true for firefighters. You know, there might be a white fire truck or a red fire truck or a yellow fire truck, but everybody sees a firefighter anywhere in the United States. They know exactly what a firefighter does, how they can help them, and what services they provide. Every single jurisdiction in the United States has a public health department. In some counties, in some states, it's a state-run event. In some, it's by the county, like it is in New York, where there's a state health department, but then administrative branches in every single county. And in some, like in Connecticut, every little town or village has their own public health officers. But wherever you are in the United States, there is a public health department there, making sure that the water's clean and safe to drink, and the food is safe to eat. And quite frankly, this is the time that America gets to see why you have a public health department and what expertise we have and how quickly we're able to kick into gear contact tracing and vaccination pods. And the health department here in Nassau is not a clinical entity. We don't run our clinics. They were contracted out a long time ago, but we're up giving thousands and thousands of doses of vaccine, not to compete with the hospitals. They're our partner. They're our partner in healthcare. The preventive side of it is very important. And, you know, across the United States, public health agency leaders like me are constantly advocating for funding and our piece of the national funding. And hopefully going forward, there will be that same knowledge of what your public health department does as you have for all of the other life-saving agencies. And the fact is, when we give shots in arms right now, that saves lives directly. I guarantee of the 50,000 people we've given injections to at the Nassau County Department of Health and the 400,000 Nassau residents who've gotten it, some of them would die if we didn't have this vaccine. I don't know if it's 2 or 6 or 10, but somebody is alive because we're giving these vaccines. And for me, having not been a clinical doctor since I joined the health department in 2009. And by the way, I was hired because of the H1N1 pandemic to help manage it as an infectious disease doctor. That's how I got to the Nassau County Department of Health, a prior pandemic that's kind of forgotten about because it was by no means as serious as this, very different characteristics. But pandemics for infectious disease and public health doctors is why we're here, to help. And so we are ready to go. It's the sort of thing that we prepare for the worst and hope for the best. And most of the time we're somewhere in between, but now we're hopefully coming out of the worst. One thing I want to do, I know County Executive Curran mentioned before our senior call center, and we heard Ms. Cona's discussion for seniors. So Nassau County did set up a senior call center where people who don't have computer access or have had difficulty can call. It's 9 to 5, 7 days a week. And the person will take down their information and we'll call them back when there's an appointment available for them, and we try and make sure it happens relatively quickly in no more than a few days. And so if I could just put that number up real quick, it's 516-227-9590. And that's for seniors in the public who have difficulty getting an appointment, navigating computers, maybe their difficulty with their eyesight or their Wi-Fi or their connectivity. We want to make sure that our most vulnerable have access to appointments. And as vaccine is becoming more available, the time that people are waiting is dropping. There's still incredible demand, but we have noticed when we used to make appointments available for our pod, I could put up 2,500 spots. They'd be gone in 5 minutes. And really, it's the most savvy computer users and the luckiest ones who are clicking, or those who are refreshing every 30 seconds around the clock, that we're getting it. Now it takes, 10 or 15 minutes to give up all those spots. So we're starting to see the pressure decrease a little bit. And I really believe for those who are waiting patiently, keep trying with all the new sites. And we hear there's a lot more vaccine coming. I believe in the next 6 or 8 weeks, just about anybody who wants it should be able to find a vaccine. So now's not the time to despair. Maybe I'm off by a week or two, but I'm certainly not off by months. So now's not the time to despair. Just keep at it. And for those seniors who need a little assistance, call this number and Nassau County will take care of you.
So thank you. And just so everyone knows, this webinar is being recorded, and that hotline that Dr. Eisenstein just said and Jennifer Cona's hotline, we will put those in the body on the text of this YouTube video on our YouTube channel. So everyone will have access to those numbers. And I do want to, as Dr. Eisenstein, I do want to say this, was talking about the health department. I was smiling from ear to ear because I was an intern at the Nassau County Department of Health while I was getting my master's in public health. And we were chatting before this webinar. That was almost 10 years ago, where I was an intern with you at the Department of Health and learning all about county government, and the story goes from there. So it's wonderful. I want to get to some of these questions. There's a lot of questions, so maybe we can just go through some of these questions.
Guy, can I break in for 1 second?
Yeah,
I
please.
realized I didn't give the number for our hotline.
Okay, I'll write it down, then we'll put them both under the YouTube video, but go ahead.
Okay, great. So our hotline, and similarly, is for anyone who's 16 over right now, you know, as the rules are. So it's 631-390-5000.
Okay, so
So
both.
regular office line, and we have one person dedicated to getting the appointments for people.
Okay, so those hotlines are for seniors anywhere on Long Island.
Yep, anyone in Long Island, 60 and over.
Okay, great. So we have a Nassau County hotline and we have Cona Elder Law hotline, and we will put those up on our website with this recording of this video, so you can refer back to it. Okay, thank you. Thank you so much. So I want to get into a lot of these questions. The first question is, there's rumors of needing a booster shot. What's the story with that?
So I think that it's way too early to give any accurate answer to whether a booster shot will be needed. If I was a betting person, I would say we're not going to need a booster in the very near future. Whether we'll need it on an annual basis, whether we may need it on a every now and then basis. There's certain vaccines that we recommend every 10 years, or certain vaccines that we recommend only when you hit a certain age. I think that the minimal evidence that we have so far, and again, we don't have a long-term evidence, but the evidence that we have so far is that these are extremely potent vaccines in terms of the immune response. And they actually do a far better immune response than you get from having natural COVID. So that's one of the questions that people ask. Well, I had natural COVID immunity. Why would I want to take a vaccine? The answer is the vaccine's probably better. The vaccine really produces levels way above what your body is going to produce after an infection. And again, some people produce a very large amount after an infection. Some people produce a smaller amount, but almost everybody produces a very high amount after the vaccine series. And I hope that we will not be needing to get an annual booster, but it's too early to say that for sure. Now, you have to differentiate between a booster and getting a shot that might have some activity against new variant strains. So the variant strains is the big unknown in this picture. If we didn't have to be concerned with variant strains, I'd be extremely comfortable saying this pandemic will end when X% of the United States gets a vaccine. And I would feel very comfortable making that statement. But with these variant strains, and not to scare people, because right now the evidence suggests that the vaccines are very good still against the variant strains, even some of the ones that we've been hearing bad things about. But they may be more contagious, they may be more virulent, they may be more potent in terms of hurting people. But again, we're not seeing serious illness, and certainly not death, even against these more difficult strains. But the question, and that's unknown, is will that continue? As strains develop, as more and more mutations occur, there is the potential, again, it's a potential, that you'll have some of these strains that no longer will be prevented by having a vaccine, at least not the vaccines that we have. And that's why all the companies are now starting to look at some of these new strains, the variations that have occurred, and some of the technology is really, really user-friendly. So they've already developed test vaccines against these strains that you've been hearing about from South Africa and from Brazil. So there are actually studies underway looking at some of these new vaccines. Now, they're not a booster shot in the classical sense, but maybe be something similar to every year you have to get a flu shot because you're picking up new strains. We don't know if they'll be necessary, but it's certainly reassuring to know that a lot of work is already underway in that regard.
So does that mean we might have to get a COVID vaccine every year?
I don't think so, but I don't know. I think that if we can really get a good handle on this vaccine and prevent so many of these variant strains from arising because most people are vaccinated, we don't need a new measles vaccine. We're not seeing tremendous variation in measles over 50 years. So you don't necessarily expect to see tremendous variation. You don't necessarily expect to need booster shots. But on the other end, with influenza, we don't have the greatest of vaccines, nowhere near as good as the COVID vaccines. And yes, you do need an annual flu shot to pick up different strains, but a cumulative benefit. If somebody gets vaccinated every year against the flu, will have better protection than somebody who's getting vaccinated for the first time against the flu. So there is a benefit in having had previous vaccinations. But for right now, it's too early to say what will be needed, if anything, in terms of additional booster or additional variant type protection
Mhm.
against COVID-19.
Okay.
I'm going to have to apologize, Sky. I do have another commitment that I'm going to get on. I can stay on for just, if you have one more question that I specifically can answer, I could answer that. But otherwise, it's been an honor to be on with the county executive, my good friend, Dr. Eisenstein. And it's nice to be on with Ms. Cona as well.
Okay. Thank you so much, Dr. Glatt.
Okay. Thank you for having this very important
Of
program.
course. Of course. Okay. We're down to 2 panelists now. Dr. Larry, do you think we'll get to a point in society where you will need a COVID vaccine in order to do certain things?
You know, I know that other countries have started talking about that. Israel has created an app where the federal government sends you permission, and in order, if you're vaccinated, you get to flash the app to show that you're able to get into theaters and public places. I hope we don't have to get to that. If we can get enough of our population vaccinated so that there's very little COVID around at all, then I don't think it needs to come to that. I mean, we don't do that for flu during flu season. You know, ultimately, if you can get enough people vaccinated, once there's enough vaccine for everybody, I envision this being in our country very much similar to flu. Most people, about half the population chooses to be vaccinated. People get sick from the flu every year and unfortunately die. Many of them are unvaccinated, and it's possible that if they were vaccinated, they wouldn't have gotten as sick. But I think enough people are going to want to be vaccinated. And I get asked, well, when kids are eligible, will you vaccinate your kids? And I have 2 teenagers, and the answer is absolutely. Why do I want them to risk any long-term health benefits for a disease that's preventable? I think the target is, as we discussed earlier, it is reasonable that people who are vaccinated are not at risk to themselves as much, and certainly not a risk to the community as much. So it makes sense that maybe they should have some extra benefits of being vaccinated. But if we can truly vaccinate enough people that we can approach herd immunity, or that we can keep disease down to very sporadic levels, it might not be necessary. I'm hoping it's not necessary. With the amount of vaccine we expect to come out March, April, May, we'd rather just get it. And then hopefully over the summer or early fall, the studies come out and kids are allowed to be vaccinated. And by then we'll have a longer experience with the current vaccines to show how safe they are. Hopefully parents will get their kids vaccinated. I will get my kids vaccinated. And you know, I think we can get to a point where a big enough percentage of the population is safe and protected. It's not going to totally eliminate disease unless we reach herd immunity. But I think we can get enough of the population protected that we don't need to resort to, you know, apps or certain passports to be able to go to events. But I do understand now why people who are vaccinated, the question is, should they have benefits and access is public access that others don't? It's an ethical question. It's a debated question. I'm shooting for getting disease so under control that it's not necessary. I think that's what our target should be.
And I know County Executive Curran said not to, obviously she said not, she doesn't recommend brand shopping, she called it, when looking at these vaccines. But a question for both of you with regard to the hotline, if someone just wants the Johnson & Johnson vaccine, is that something that you'll address to someone? If they call you and they say that they just want that vaccine, will you direct them in one way or another?
No, because we get our allotment of vaccine a week at a time. And so if we make an appointment for you, you call on, you know, Friday, and we give you an appointment next Tuesday, we don't know what vaccine is coming. Mm-hmm. So the health department has received 99% of what we've received is Moderna. And then all of a sudden I got a bolus of Johnson & Johnson that we got, you know, very short notice was coming. And we really want to use the Johnson & Johnson as a 1-dose vaccine. Is really a game changer, especially for hard to reach communities. Ms. Cona and I were speaking earlier, you know, homebound people. It's so much easier if visiting nurses and caretakers just need 1 visit of vaccine versus 2. Mm-hmm. Pharmacies, doctors' offices, where people, you know, a doctor's office is very busy. They don't need people coming in twice just for 2 shots, 28 days apart. So I think the guidance that comes down from the state is going to be very strategic about what vaccine there is. if you ask us and we know, we'll certainly tell you. We're not hiding it until you show up. If we know that this week, I know if you have an appointment tomorrow at the health department's pod at Nassau Community College, tomorrow we're offering Moderna. That's what I have. If you want Pfizer, you want Johnson & Johnson, you obviously don't have to take the Moderna. We're not making anybody take it, but I don't have it to give you. So you'd have to find an appointment somewhere else. And really, a matter of life or death, it was said by county executive and Dr. Glatt, take what you can get.
Mm-hmm.
All three of them are considered to be almost perfect at preventing death.
Mm-hmm.
That's where the conversation should end, in my opinion.
Okay.
And I have to say, in my experience, that the people that we've helped get appointments, they have not been concerned at all with which vaccination they're getting, and they haven't even been very concerned, because we can't guarantee what location they're going to get or time of appointment that we are able to secure for them. People have been just more than grateful that we're able to get them an appointment. They're willing to travel for it. So we have found in my office that people are just very appreciative for what we can secure for them, and they're willing to do what they can to get vaccinated.
There were a lot of situational questions that came in, and, we don't have time.
Could I just,
Yeah.
I don't mean to interrupt you, just one thing, and it's important, as Ms. Cona said, one of the things that we see is people they were so desperate, they're making first and second dose appointments wherever they can get them. Very often, it's not even the same vaccine in the two locations. So please make sure your second dose appointment is in the same location that you got your first dose, because the people who gave you the first dose are responsible for ensuring that you get the same second dose. And we have a lot of situations of people who come looking for help. Oh, I didn't realize I made a second dose appointment. It's not the same. I want this one. It doesn't work like that. We get an allotment where when we give you a first dose, we get an allotment that matches it for you at the appropriate time. So please make that first dose appointment, and the second dose will happen automatically for you.
Okay.
To be clear, everyone leaves with their second dose appointment when they get their first dose.
Well, for us, we send you an email that night or the next day for you to pick a time for your second dose appointment. So it doesn't always happen on the spot, but it certainly happens within a day or two. And the way we do that is we can accommodate. So if you got your Moderna today, we know 4 weeks from today, 28 days, you're getting it. But maybe we have morning hours, or maybe we have evening hours for you. You get the link and you get to pick your time. But the people who give you your first dose are responsible for making that second dose appointment. Sometimes it happens that day or within a day or two. We explain to everybody, when you go home tonight, you'll get an email from us. It's automated, and that way you can pick what's convenient for you on that day.
Okay. Well, I'm glad that you mentioned that, because then we'll remind people of that when we get their first appointment, because then they're not really circling back to us, but we can let them know to make sure that they're sticking with that, because the last thing we want to do is have missed second dose appointments. That's going to throw the whole thing out of whack. So I appreciate that, and we'll just reinforce that messaging.
Yep.
Okay, so there were a lot of questions that we didn't get to, but I think a lot of the questions that did come in were answered throughout the course of the discussion. For example, when can a healthy 34-year-old be able to get vaccinated? And like you mentioned earlier, that guidance comes from the state.
Yeah, now President Biden said anybody who wants a dose should be able to get it by May 1st. I think based on supply and demand, that's going to happen here in New York well before May 1st. So I think this is just the best guess. It's certainly up to the state to determine it, but I think based on the percentage of no-shows we're starting to see, because people make an appointment, then they get another appointment somewhere else, I'm guessing early April you'll see the eligibility open up broader and eventually to anybody.
Okay, and then do people have to bring any sort of identification of, demonstrating their eligibility to these vaccine sites? That was another question that came in.
Absolutely. So, now it's become less of an issue now that there's many more people eligible. But for example, when we were doing teacher vaccinations, you had to prove that you were a teacher. If you were a senior, we check your license, your ID. And if it's 60 and over and you show up and you're 59, we're not able to vaccinate you. This is under a state executive order. And there have been a lot of people frustrated that said, oh, it used to be 65 and we have people, I'm 61. But no, you're not 65. We're bound to the rules, and close, unfortunately, doesn't meet the executive order. And Ms. Cona can give you the legal perspective on that. But we try to be reasonable, but we have to follow the rules in the executive order. So if you say, the one thing we're not asking you is for, if somebody has underlying health condition, Nassau County Health Department's not asking you for a doctor's note. We're just asking you to attest at your own legal attestation that you have one of the health conditions that's on the list. Our people aren't asking you, we're not getting into your private business with that, but you do have to attest, and the state has said they're willing to audit it. So we keep all the attestation forms. And, but other than that, if you're there because of you're 30 years old, but you're there because you're a mass transit worker, we're going to check your ID. If
Okay.
you're, if you're there because of your age, we're going to check your ID anyway. So yes, we do, as long as there's eligibility criteria, we're going to make sure that you meet the eligibility.
Okay. I know I didn't realize the time. It's 7:01 already. So I want to ask each of you maybe give any concluding thoughts as we wrap up this episode of Herald Inside LI. It was the least conversational of any of our episodes, but it was extremely informative. Jennifer, would you like to go first?
I would say that, like I said before, take a look back at what we've learned over the course of this year and plan ahead to protect yourself and your family members and your loved ones.
Dr. Larry.
Let's get through this just a little longer. Let's be smart, get vaccinated as quickly as you can. Please don't take the actions that spread disease, especially young people who think they're, think that they're not in any danger. They could still spread disease. So until we have this knocked out, be smart. As the weather warms, start to enjoy living here on Long Island and be outdoors. And if we all do our part, we can have a normal summer. Let's think positively.
Okay. Thank you. This is our concluding slide. For anyone with any questions or anything, here's our email address. And again, the 2 hotline phone numbers that Dr. Eisenstein and Jennifer Cona talked about, we will put under the recording of this episode of Herald Inside LI on our YouTube page. I'd like to thank our sponsors, Cona Elder Law in Mount Sinai, South Nassau, and to our Dr. Larry Eisenstein for being on the panel. Laura Curran was on the panel, our county executive, Dr. Glatt, and of course, Jennifer Cona from Cona Elder Law. Thank you, audience. Thank you, panel. And be safe, everyone. And good night. Thank you so much.
Thanks for having me.
Thanks,
Good
guys.
night, everybody.